My name is Jessica Hulsey, and I am the president and CEO of the Addiction Policy Forum. We represent patients and families impacted by the disease of addiction. We work to provide crisis care to patients and families to end the stigma that exists around addiction, translate the science for those that need to better understand this illness and how to treat it. And we work with all stakeholders to bring folks to the table. At APF, we sort of felt immediately that the pandemic was going to have a huge impact on patients and families. I think it was like a matter of hours into the shutdown that we were hearing from people who were in distress and cut off from services and needed resources and treatments that they required for their substance use disorder. So sadly, I think the COVID epidemic, the pandemic, has been sort of a head-on collision with the opioid epidemic and addiction, sort of creating a perfect storm: loss and anxiety and isolation and stress. These all exacerbate addiction and interruptions in treatment and services, recovery support meetings. All of this led to relapses, recurrence of use, overdoses and overdose deaths. We saw 93,000 overdose deaths last year. So the human toll this has taken is very severe. Addiction Policy Forum, we did a research project really pretty early into the epidemic, the pandemic, and we found that 1 in 3 of our patients were reporting disruptions in services, that we were finding that the isolation and the stress and anxiety in particular were really difficult to manage. And even individuals who had years of sort of stability and recovery were struggling in this, and families were struggling too. As we sort of deal with the Delta variant and figuring out what this fall looks like, I think we need to remember that resources to support recovery. This is a chronic health condition, addiction. We need to have sometimes lifelong support to make sure that we're managing our chronic illness. And services in this sort of department should not be disrupted. I think we need to double down on making sure we have a safety net for those who are struggling with SUDs or in recovery and their families, to make sure that we're meeting the needs. So I think that while we've made a lot of progress and there's been lots of attention and focus on addressing the opioid epidemic, there's still a lot more that can be done. We need to make sure that we have universal, easy to access naloxone, the overdose reversal medication, and that's made available to patients, to families, to first responders. We've had shortages of naloxone reported during the pandemic. And as we're seeing increases in overdose deaths, that's just not acceptable. So how do we make this life-saving medication to reverse an overdose? And then how do we ensure that we are connecting individuals who have a non-fatal overdose to treatment? Addiction is the most stigmatized health condition on the planet. And I think that that's a reality that we are trying to tackle and come up with new interventions and things that we can do. But we can all start and be a part of the solution by minding our own language, right? The language does matter. My mom struggled with an opioid use disorder. And when people use terms like addict or junkie, they dehumanize and take this out of the health condition and assign blame and shame to that individual, that patient struggling with an illness. So it's really important that we use person-first language: a person with a substance use disorder, a person with an opioid use disorder, a person with a methamphetamine use disorder. Making sure that the person is the focus of that sentence, that phrase, that moment that you are taking to talk about this illness. I think that's it's really important to remember that. The other thing that is part of the language change is, and there's been lots of discussion about this, but it's important we say substance use disorder or substance use instead of substance abuse. And here's why. The word abuse is commonly thought of in terms of domestic abuse or elder abuse or animal abuse. This is a criminal justice term. This is not in reference to a health condition, which addiction is. You can find recovery from it, and we need to make sure that we use the health terminology, which is a substance use disorder, and not something that is more lends itself to a criminal justice term. And it's a reminder that this is a chronic health condition that we can better prevent and we can better treat.